cutbacks happened. We once again had a long-term care unit in an acute care facility, and Ralph decided that we would no longer have long-term care beds in an acute care hospital. My position was cut from a full-time position to part-time, and they moved me from the Peter Lougheed to the old General Hospital. I stayed at the old General Hospital till 1997. I was very fortunate around 1995 to get a full-time position in psychiatry. Now, my involvement at the union actually really started to increase at our local unit. I was encouraged to run as the local unit chair, and in those days worked with Kay Wilkins. And this was just about 6 months before the old General Hospital was being imploded. Now, we saw when that happened, a number of our colleagues from health sciences move over to the Peter Lougheed Center, which was a unionized facility, and the rest of us moved to Foothills Hospital, where the professionals were not unionized. The technicals were, so your people in terms of your lab, x-ray, your respiratory therapists, they were part of health sciences. And Children's Hospital was not unionized in those days. So there was discussions in terms of health sciences coming into Foothills and Children and talking to the employees about the benefits of belonging to a union. And I remember one colleague saying, well, you know, things are going pretty good because the employers following the contract were getting the wages just like the unionized workers. We're getting all the benefits, but we don't have to pay. The union do. So why would I want to be part of a union? There was a lot of education that happened. At that time, it was Elizabeth Ballerman, and she came in and said, the employer does not have to follow the contract, and in times when things are not going to be good, that's when you're going to ultimately see that your wages can go down, that if there was a grievance, there would be nobody to assist you in that area. And there was a lot of education that happened to the workers. And then the Alberta Labour Board had a hearing, and there were a few of us who were now in the non-unionized sector that were actually sequestered to come and speak to the Labour Board. And I remember one of the questions they asked me was, well, what do you think the benefits are? And I said, it's giving the workers the opportunity to be respected as workers, to understand that when they do have difficulties, there is somebody to go to. And I remember saying, I think what you need to do is you need to allow the people here in Calgary, because this was just a Calgary specific concern, the opportunity to vote, to decide if they wanted to be part of a union. If they didn't, Edmonton was going to remain part of health sciences, but Calgary would not. So when the vote occurred, and this would have been, I'm saying about 1998, it was around 87% in favor of being unionized as professional workers. That sent a message because people realized that they wanted to have that voice